How to avoid B12 deficiency. A vitamin B12 deficiency can lead to a plethora of symptoms, ranging from bothersome nuisances to permanent neurological damage. If a vitamin B12 deficiency is allowed to persist, it can contribute to anemia, in which the sufferer has a dangerously low red blood cell count. A vitamin B12 deficiency may also lead to neurological issues, whether or not you are also suffering from anemia. Shockingly, vitamin B12 deficiency likely affects between 1.5 and 15% of the United States adult population. Monitor your diet and health to ensure an early diagnosis of any vitamin deficiencies, and treat a vitamin B12 deficiency promptly to diminish any detrimental effects upon your health. Maintaining healthy amounts of vitamin B12. Eat the recommended daily value of vitamin B12. Daily values are assessed according to the approximate daily recommended amount of a specific nutrient for a healthy adult. For vitamin B12, the daily value is 6.0 mcg. If you consume meat daily, you are likely already consuming this amount. However, absorption of vitamin B12 can be complicated by several factors. In any event, monitor your diet to ensure you are getting enough vitamin B12. Eat foods rich in vitamin B12. There are several animal products and fortified foods that are sources of high amounts of vitamin B12. Fish and other seafood, meat, eggs, and dairy are especially good sources. If you are a vegetarian, opt for cereals or nutritional yeasts that have been fortified with vitamin B12. Clams and beef liver each contain over 10 times the recommended daily value of vitamin B12 in a single 3-ounce serving. Rainbow trout, sockeye salmon, and tuna are the next 3 natural sources of food with the highest content per serving. If you're a vegetarian, eat a serving of a breakfast cereal that contains 100% of the daily value of vitamin B12 every day. Monitor your vitamin B12 intake closely if pregnant or breastfeeding. Aside from lifestyle decisions such as not eating meat, there are other factors that increase your need to consume extra vitamin B12. For instance, if you had a poor diet as an infant, or you are currently pregnant or breastfeeding, you need to closely monitor your vitamin B12 intake. The recommended daily allowance of vitamin B12 for a pregnant woman is 2.6 mcg, and 2.8 mcg per day for a nursing woman. These should be considered minimum amounts to consume daily. If you are thinking of getting pregnant, you should consider taking vitamin B12 1 month before you plan to conceive. Choose a prenatal vitamin with 400 of folic acid. Show your doctor your prenatal vitamins to make sure it is right for you. Recall that the recommended daily value for a healthy adult, which better reflects the relationship between food servings and access to the nutrients they provide, is 6.0 mcg. Take a vitamin supplement. If you know you are not meeting the recommended daily value of vitamin B12 or other vitamins, consider taking a multivitamin. While eating a healthy diet is a better way to get the vitamins your body needs, multivitamins are a good option if your diet is restricted. Talk to your doctor if you are unsure about which types of vitamins to take, and whether this may be the best approach to ensuring you are getting sufficient nutrients. Know that your ability to absorb vitamin B12 from a dietary supplement is limited by your stomach's natural contents. For example, taking a 500 mcg supplement orally will only lead to the actual absorption of only about 10 mcg of the vitamin. In addition to oral supplements, you can also get tablets or lozenges that will dissolve beneath your tongue, and even liquid supplements. While different mediums are said to provide greater bioavailability, there is not a considerable difference between your body's ability to absorb oral versus sublingual forms of vitamin B12. Avoid smoking, and drink only in moderation. Both smoking and drinking alcohol can interfere with the absorption of vitamins and contribute to various forms of deficiency-related anemia. If you smoke, begin the process of quitting by talking to your doctor about the options to help you do so. Drink 1 to 2 drinks a day, at most. Recognizing symptoms and risk factors. Watch for mild symptoms of vitamin B12 deficiency. Symptoms that may indicate your body is lacking in vitamin B12 can include extensive discomfort. While this deficiency may lead to serious issues involving your cardiovascular health and cognitive function, it will also your daily energy levels and physical endurance. In terms of energy, you may feel fatigued, unable to concentrate, short of breath, and even lightheaded when standing or following exercise. You may lose your appetite, and your skin may become more pale than usual. Your tongue may swell and redden, and your gums may bleed more easily. You may suffer from diarrhea or constipation. Know the natural causes of vitamin B12 deficiency. In addition to a dietary deficiency leading to an inadequate amount of vitamin B12, there are several health conditions that reduce your body's ability to absorb the nutrient, and thus may also place you at greater risk. If any of these medical conditions apply to you, make sure you account for their potential effect on your nutritional absorption. There are 5 things that need to happen for the absorption of B12. These include dietary intake, acid pepsin in the stomach to liberate B12 from proteins, pancreatic proteases to free B12. Secretion of intrinsic factor by parietal cells, and an intact ileum that can absorb intrinsic factor B12 complex. Be aware that any diseases that complicate digestion including Crohn's or celiac disease may diminish your body's access to nutrients. Fortunately, if these diseases are properly treated, any vitamin B12 absorption issues may also be resolved. Note that pernicious anemia, which affects your stomach's supply of something called intrinsic factor, makes it extremely hard for your body to process vitamin B12. Your doctor will help plan a specific treatment regimen if you are found to be lacking in intrinsic factor. Stay on the lookout for severe symptoms of vitamin B12 deficiency. Low amounts of vitamin B12 for long periods of time can lead to very serious health issues, including nerve damage. Initial signs of nerve damage include depression and other changes in mental state, a diminished sense of balance, and a tingling numbness in your legs or hands and feet. These neurological symptoms may become apparent without the presence of anemia, which is a condition of the blood. Watch out for neurological issues, as early intervention is vital to avoiding potentially irreversible damage. Recognize the effects that certain surgeries and behaviors may have. Relatedly, know that the habitual use of antacids and/or heartburn medication may also lead to complications regarding vitamin absorption. One of the most integral aspects of recovering from a gastric bypass or other surgery that affects your gastrointestinal system is ensuring that your body is still able to absorb enough vitamin B12. Be sure that your dietary regimen accounts for this necessity following such a surgery, and know that you will likely also have to take supplements of vitamin B12. If you have been taking antacids or heartburn medication for a long time, make sure your doctor knows about this when talking with them about a potential vitamin B12 deficiency. Treating a vitamin B12 deficiency. See a doctor for a professional assessment. If you are concerned about your nutritional intake or any recurring symptoms that may be related to vitamin B12 deficiency anemia, see a healthcare professional as soon as possible. One of the first exams you will receive is a physical examination to ensure that there are not issues with your reflexes. Other important tests you should talk about with your doctor are your complete blood count, your reticulocyte count, your LDH protein level, and your actual vitamin B12 level. Causes of B12 deficiency include pernicious anemia, gastrectomy or gastritis, H. pylori infection, age, intestinal disorders, tapeworm infestation, medication, inadequate dietary intake, and HIV infection. Choose a treatment option based on the cause of the deficiency. If there are no health complications that make it harder for your body to process vitamin B12, you can likely simply add more of this nutrient to your diet. The goal of any type of vitamin B12 deficiency treatment is to increase your levels of vitamin B12. This may only require dietary changes. Treatment options that your doctor may recommend also include high-dose vitamin B12 tablets, or even vitamin B12 injections. Get vitamin B12 injections. If you have a medical or lifestyle complication that prevents your body's absorption of the nutrient, injections are a viable route to ensure you're still getting the vitamin B12 your body needs. Again, your body's ability to absorb vitamin B12 is the primary factor in determining whether these injections are a necessary form of treatment, as taking vitamin B12 supplements by mouth is adequate treatment for most patients. If your doctor deems it necessary for you to receive injections, know that you may need several injections within the first few months of treatment. After a few months of treatment, you will likely need one shot per month, potentially for the rest of your life.